Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Imagine this. You or a family member wakes up with a painful urinary tract infection. Your clinician prescribes an antibiotic, and the pharmacy calls. The medication is on hold for prior authorization. By the time the approval comes through, pain has worsened and the infection has spread. That delay might have been preventable. Today, we're unpacking why this happens and exactly what you can do about it. Here's the promise for this episode. I'll explain what prior authorization actually is, why insurers require it, and how those rules play out in real clinics. I'll give you practical checklists, exact scripts you can use with doctors, pharmacies, and insurers, and a step-by-step plan for appeals when a request is denied. By the end, you'll have 3 clear takeaways you can use right away. Section 1. What is prior authorization and who does it affect? Prior authorization, often called prior auth, is an administrative process used by many insurers, including Medicare Advantage and private plans. It's not a medical exam by your doctor. It's an insurer reviewing a proposed service, medication, test, or specialist visit before they agree to pay. Providers usually submit the request, but patients are the ones who feel the delay. Common items needing prior auth include certain brand name medications, advanced imaging like MRIs, non-emergency specialist referrals, durable medical equipment, and some procedures. It's a gatekeeping step insurers use to make coverage decisions before care happens. Why do insurers require prior authorization? There are a few reasons. First, medical necessity. Insurers compare requested care to their coverage rules and clinical guidelines to see if it meets their criteria. Second, formularies and step therapy. Insurers prefer lower cost or preferred drugs first and require documentation that those were tried when appropriate. Third, cost control. Controlling utilization of expensive tests and treatments helps insurers manage premiums. And fourth, clinical review. Some plans use evidence-based pathways to decide what's appropriate. Importantly, these rules vary wildly between plans and even within the same insurer over time, so you can't assume consistency. Section 2. Real consequences and practical prevention. Prior authorization isn't just paperwork. Delays can worsen symptoms, extend infection risk, postpone cancer staging, or increase anxiety for patients waiting for answers. I work in clinics where I've seen patients return in worse pain because a medication was delayed, and family members stressed because a needed MRI was postponed. These are anonymized, but common scenarios. Here's a practical checklist to prevent or shorten delays. For patients, 1. Know your plan in pharmacy. Have your member ID and pharmacy info handy. 2. Share past treatment history. List medicines you've tried and outcomes. 3. Ask if the requested item needs prior auth and ask for an estimated timeline. For clinicians and clinic staff, 1. Submit complete documentation the first time, including diagnosis codes, recent labs or imaging, and trial of alternatives when required. 2. Use electronic portals when available. They often speed submissions. 3. Request an expedited review when the patient's condition is urgent. Timing tip, submit authorization requests before the appointment when possible, so decisions aren't made after the patient leaves the office. Curious. Section 3. Scripts, documentation, and what to do if a request is denied. Let's start with exact language you can use. With your clinician or clinic staff. My medication or test is on hold due to prior authorization. Can you confirm you've submitted the authorization request and share the submission ID or reference number? That gives you a trackable item. At the pharmacy, can you tell me the insurer's reason for hold and the date the request was submitted? With the insurer, Please confirm receipt of a prior authorization request for service, drug. Provide the reference number and tell me the estimated decision timeline. Use calm, concise language and get names and reference numbers. Documentation that speeds approvals, diagnosis codes, and a short clinical note explaining why this therapy is medically necessary, prior treatment attempts and dates, lab or imaging results that support the diagnosis, and any specialty consult notes. If the insurer requests a specific form, complete it completely. Missing fields are the fastest route to a denial or delay. Keep copies of everything you or your clinic submit. If an initial request is denied, don't panic. Here's a step-by-step appeal plan. Step 1. Ask for a peer-to-peer review. Request that your clinician speak directly with the insurer's clinical reviewer to explain the medical rationale. Step 2. File a formal appeal within the insurer's timeline. Include the full clinical record, a cover letter that summarizes why the service is necessary, and any specialty support letters. Step 3. If internal appeals fail, explore external review or state consumer protection options. Many states have external review processes for coverage disputes. Always document dates, names, and outcomes at each step. Quick scripts for appeals. To your clinician, can you request a peer-to-peer review and prepare a letter of medical necessity that highlights failed treatments and objective data? To the insurer on appeal filing, I'm filing an appeal for claim/reference number X. Enclosed are records and a letter of medical necessity. Please confirm receipt and provide the expected decision date. Keep your tone firm but cooperative. Before we wrap up, here are 3 clear takeaways you can use today. Takeaway 1. Ask early. Always ask if a prescribed medication, test, or referral needs prior authorization before leaving the appointment. Takeaway 2. Get documentation right. Supply complete clinical notes, trial histories, and objective data to speed approval. Takeaway 3. Appeal smart. Request peer-to-peer reviews, file timely appeals with strong supporting records, and involve your clinician. Don't try to fight complex appeals alone. If you want a one-page checklist and sample scripts I mentioned today, visit the episode notes. I'll include links and printable templates. If a particular case feels complex or you're facing life-changing denials, consider legal or advocacy help and ask your clinician to support escalation. Insurance rules vary, so always confirm specifics with your insurer and clinical team. Before we go, if today's episode helped clarify how prior authorization works or gave you tools to act faster, please subscribe. It helps this education reach people who need it most. Share the episode with a friend who's been stuck waiting for care. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at FAQbyNurseJessConsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.